Students, in today's lecture we will discuss the neurogenic bladder. The normal function of the urinary bladder is to store and expel urine in a coordinated and controlled fashion. This coordinated activity is regulated by the central and the peripheral nervous system. So these are the two systems which are controlling the normal functioning of the urinary bladder. Now, urination or micturition, it is the process of expelling urine from the bladder. The urge to urinate happens at about 200 ml of urine in the bladder. So if the 300 ml of urine is there, the urge becomes more strong. In 500 ml of urine, the urge becomes uncomfortable. The over-distended bladder may have over 1000 ml urine. Now the normal micturition, it is possible only when the spinal segments together with their afferents and efferent nerve fibers are connected with the micturition center. Now before the discussion of the neurogenic bladder, we should know the nerve supply of the urinary bladder. So two types of nerves they are going to supply, that is motor and sensory. First is the motor supply to the urinary bladder. First is sympathetic, which is the fibers are from T11 to L2. They are inhibitory to the detrusal muscles. They stimulate the closure of the sphincter vesicae. So because of this action, these sympathetic fibers or sympathetic nerve is also called as nerve of filling. Now the parasympathetic fibers, these are S2, S3, S4. So these are nervi urgentis. They stimulate the contraction of the detrusal muscles. They inhibit the action of the sphincter vesicae. So because of its action, it is also called as nerve of emptying or voiding. Because for emptying the bladder, the contraction of the detrusal muscle is required with the relaxation of the sphincter vesicae. Now third set of motor supply is by the pudendal nerve, that is fibers are from S2, S3, 4. Then these are motor to the urethral sphincters, responsible for the voluntary control of the micturition. So their action is on the urethral sphincter. So these two fibers are acting on the sphincter vesicae. Now coming to the sensory supply, the afferent pass through the parasympathetic nerves via pelvic subplanchnic nerves. They enter through the S2, S3, S4, you can see here. Then sympathetic fibers, they pass via hypogastric plexus, enter L1 and L2. Now coming to the neurogenic bladder, it refers to the dysfunction of the urinary bladder due to the disease of the central nervous system and the peripheral nerves involved in the control of micturition. Now these are the three broad classifications of the neurogenic bladder, that is automatic, autonomous and atonic bladder. This automatic reflex bladder it results from the complete transection of the cord above the micturition center, that is S2, S3, 4, because this is the site of micturition center and this is the cortical micturition center, which is the control in the brain. So that is in the paracentral lobule. The spinal micturition center is at the level of S2, S3, S4. So here the micturition center is there. So this automatic reflex bladder is happening when the transection of the cord, it happens above the micturition center involving the pyramidal tracts. So this is upper motor neuron lesion. Why? Because it is above the micturition center. Now clinically, the voluntary inhibition and the initiation of the micturition is lost. The bladder empties reflexly after every 1 to 4 hours. So reflex contraction is there. So filling of the bladder, it happens slowly and slowly. The reflex, the stimulus or the information is going to the micturition center and reflexly they empty the bladder. When the filling reaches a certain level, the detrusal muscle contract reflexly as it is seen in early infancy. So in early infancy, the automatic reflex bladder is there. If this picture is seen in case of transection or any injury to the spinal cord above the micturition center, so this bladder is seen, that is automatic reflex bladder. Coming to the autonomous bladder. Autonomous means independent, loses all control and sensation. It occurred due to the destruction of the S2, S3, S4 segments of the spinal cord. The lesion is happening in this part. So clinically, what will happen? The reflex and nervous control of the micturition is lost. The bladder wall, it becomes flaccid and capacity is greatly increased. It merely fills to capacity and overflows, results into the continuous dribbling. The bladder may be emptied by the manual compression. So autonomous bladder is there. The infection of the urine and back pressure effects on ureter and kidneys are inevitable. So in this condition, the residual urine it is there, so that's why the infection chances are there. Coming to the atonic bladder, this is a sensory interruption of the reflex arc. So here the sensory interruption of the reflex arc is happening as seen in tabes dorsalis and spinal shock. The large volume of the urine it collects without any reflex contraction. The bladder muscle wall is relaxed, sphincter vesicae is tightly contracted, sphincter urethrae they are relaxed. The patient is unaware that bladder is full because interruption in the sensory interruption of the reflex arc is there. So patient is unaware that bladder is full, so the bladder becomes greatly distended and finally overflows. So these are the three important types of the neurogenic bladder. Thank you very much.